Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
I have a question here about a parent, a worried parent, as they say. My daughter may be anorexic. I'm very worried about that, but how can I tell and where should I seek help?
We're living in a very interesting time, aren't we? We've got a great lot of anxiety about obesity. And at the same time, we've got this whole celebrity culture and girls trying to make themselves very thin. All this stuff on telly about size 0 or size 2 and how ridiculous is all of that. So there are a number of girls who seem to often find themselves perhaps a tiny little bit plump when they're going into puberty. Someone says something that's not quite right or upsets them, and then they start going on mad diets. And if you're worried that your child really is eating very little, but has a self-image, which is that they're fat, when you can very clearly see that they're not, that is the time that you need to seek help.
And it's often called body dysmorphia,
isn't it? It is. So you look at them and you're looking at them, you're thinking, wow, you're looking rather too thin. And they're looking at themselves and they're still thinking that they're fat and they need to lose weight.
So you start off by seeing a GP, but you need a referral somewhere.
Usually, I mean, a GP will take one look usually and say, I think we need to see a paediatrician. And often it will be a paediatrician along with the child psychiatrist who will be involved, not just in looking at sort of the general health side of things, but also the issues which are making a child want to keep losing weight.
Yes, you need to kind of unlock the problem, don't you? You need to find the key. And as a parent, you're often too close to it, aren't you, to see it?
You often are. And I think that catching it early is often very helpful before it becomes very entrenched, because severe anorexia actually has quite a high mortality. So it can be a very serious problem. And I think the message to parents is, if you're worried, go and seek help. Don't do this on your own.
Brilliant. Sue, thank you very much indeed. And if you have a similar problem, we hope we may have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.